I'm Dr. Jeffrey Epstein of the Foundation for Hair Restoration with offices in South Florida and New York. So how does one care for a hair transplant after it's been performed? There's really not much that a patient needs to do because once they leave the office, they are going to leave with a bandana typically on the top of their head. They can start wearing a baseball cap the very next day, but when they leave the office, they're wearing a bandana that helps conceal what was done. They can go home, and we recommend during that first evening that they take it easy. It's fine to go out to dinner and walk around, but we don't recommend that they do too much physical activity. So having dinner with a family member, family or friends, or going out, or a lot of my patients choose to take advantage of that time and sit back and watch TV. The next day, patients come back to the office. The majority of my patients, especially those that live here locally in my practice, come back and we wash their hair for them. So then they're able to go out in public with, in many cases, just wearing a baseball cap. And sometimes if they had the transplants in an area where there's already existing hairs, they're able to conceal what was done with the use of a topic concealing powder. Patients can shower the day after their procedure, and then they can start to wash their hair themselves starting on the third post-procedure day. So the procedure is done on a Monday. Usually I recommend that we wash their hair for them on Tuesday, and then on Thursday they can fully wash their own hair. Starting on the fifth day after the procedure, so that would be on a Saturday to a Sunday, they can then start to wash their hair themselves normally with no restrictions. Normal exercise is permitted with the exception of swimming on the sixth day. And there's really very little other care that needs to be done. If the use of self-absorbing sutures were done, then those stitches will simply dissolve by themselves.